So let me talk about a revision of the order that we're issuing today. And I want to go back a little bit in time. We're calling this an Urgent Health Advisory, Ohioans Protecting Ohioans. Urgent Health Advisory, Ohioans Protecting Ohioans. Since the original stay-at-home order, a lot has happened. Our orders have evolved, and the circumstances have evolved in Ohio as well. So it's now time for our orders to reflect the reality of where we are today. These really are the essential facts. One, Ohioans, through social distancing, have avoided overwhelming our hospitals, and we have flattened the curve, and that has been great work by all of you. Number two, a new number for some of us learning it, but we've been watching it for a while in Ohio. The R0 number is now 1 to 1. It had been 1 to 2, which simply meant that one person was, on an average, was infecting 2 people. Now those numbers are down 1 to 1. Number 3, a lot of our fellow Ohioans have worked very hard to come up with the best practices for business as they reopen. Those best practices that have been worked out by business, by professionals, by people in the health community are now orders. We have put in place a specific framework for how business operates that was not in place when we issued our original stay-at-home orders. These new orders protect employees and customers alike. 4, our original stay-at-home order had exceptions, including such things as going to the grocery store, to the pharmacy, checking on elderly relatives, attending funerals, weddings, church services, walking in a park, to name a few. Each order, number 5, each order that has reopened a business sector has created additional exceptions to the original order, which has in turn created additional opportunities for people to leave home. 6, in fact, on April 30th, we changed the name of the order from stay-at-home order to a safe-at-home order. And so we are now moving from orders to strong recommendations. This is a new phase in our battle against the virus, and it really is even more incumbent as we open up Ohio economically. It's really more important and incumbent upon each of us to protect each other. Our new urgent health advisory is titled Ohioans Protecting Ohioans. It incorporates 6 feet of social distancing, a limit of 10 people for mass gatherings, frequent hand washing, other sanitation efforts, etc. It incorporates all the business orders about social distancing and sanitation, including employees wearing masks, as well as efforts to protect employees and other efforts to protect the public. All of those are incorporated in this new order. Let me talk about our most vulnerable Ohioans. Our new urgent health advisory considers our most vulnerable Ohioans as those who can suffer the worst impact from the virus. They include those who are 65 years of age or older. They include people of all ages with underlying medical conditions, including chronic lung disease or moderate to severe asthma, serious heart conditions, compromised immune systems, obesity, diabetes, chronic kidney disease, and liver disease. Our Urgent Health Advisory strongly recommends that these Ohioans stay at home as much as possible. They should avoid places where they're likely to encounter a lot of people. When they go out in public, they should wear a mask unless not otherwise indicated, and should practice good hand washing hygiene, and should, of course, practice the social distancing. They should limit trips out. They should be exceedingly careful. That's for our most vulnerable Ohioans. And again, it is a significant number of people, because it's not only those over 65, but it's also those with the medical conditions that we just listed. And again, these are not new. You've heard Dr. Acton talk about these medical conditions many, many, many times. Let me talk about the rest of Ohioans. For everyone else living in Ohio, we today call upon your sense of personal responsibility and accountability to others. Those Ohioans not considered at high risk certainly can carry the virus. They can spread the disease even when they're showing no symptoms and unaware they are carrying that virus. Even those Ohioans who are not the most vulnerable for death from COVID-19 are certainly vulnerable, we have learned, and we have seen. They're vulnerable to developing severe complications, such as a stroke, and experiencing long, extended stays in the hospital, as we heard from the two individuals who called in the last few days. Our health advisory recommends, but does not require, it recommends, but does not require that those Ohioans, the rest of the Ohioans, stay at their place of residence when possible, with the intent of lowering the rate of the spread of COVID-19. Young, healthy Ohioans should take protective action, and any Ohioan should take protective action because they could unknowingly pass this virus on to one of their fellow citizens. All individuals in Ohio are advised to take precautions to limit the spread of this disease. And again, this could occur unknowingly, as we know that there are many people who carry the virus but who do not show symptoms and certainly do not know themselves that they have it. Let me talk a moment about travel. While orders have included limited travel restrictions, these will now be lifted. However, while unnecessary travel within or outside the state of Ohio is permitted, it certainly is not encouraged. And we certainly, while it is permitted, advise people to make their own judgments by whatever the situation is, who they have in their household, who they're traveling with, and where they are traveling, and who they interact with when they travel. Again, these are up to each individual. We would just ask that they be cautious. Persons who have tested positive for COVID-19 and have not recovered or are presumptively diagnosed with COVID-19, or if they are exhibiting the symptoms identified in the screening guidance available from the CDC and the Ohio Department of Health, shall not enter the state. This is not a change, unless they are doing so under medical orders for purposes of medical care, or being transported by emergency medical services, EMS, are driving or being driven directly to a medical provider for the purpose of initial care, or a permanent resident of the state. Ohioans take care of Ohioans. That is really the core of who we are. And Ohioans have done this very, very well for the past several months. It's how we flatten the curve. That's how we have helped slow the spread of this deadly virus. That's how we have saved the lives of many Ohioans, our neighbors, our friends, our loved ones. And that is how we are going to save our economy. That's how we're going to grow our economy, because we cannot separate keeping safe, keeping the virus spread down, and growing the economy. Without keeping that virus down, we cannot recover economically, nor, of course, can we recover from a health point of view. The coronavirus is not gone. It is real. and it is deadly. This new phase that we're now in is about learning to live with the virus. It is with us. It will remain with us for a while, and we must do all we can to contain it and keep it from killing our fellow citizens. What this comes down to now is that each of us has a responsibility to each other to slow the spread. No other time in our lives, no other time, my guess, for all of us, we will have no other time in our life when our own individual actions or inactions can impact the lives of so many of our fellow citizens. The virus, of course, has now become one of the leading causes of death in Ohio. Preliminary research indicates that as of May 19th, more than 90,000 people in the United States, including 1,720 Ohioans, have died with the COVID-19. These numbers, as we have seen here, continue to increase daily. Cases have been detected in all 88 counties. The majority of hospital admissions and deaths are among adults age 60 and older. However, another interesting statistic, nearly half of reported COVID-19 cases in Ohio are among adults ages 30 to 59. The risk to the health of all Ohioans does remain high, and we must protect each other. We owe it to each other. What we do individually will be what saves Ohioans collectively. Taking the protective actions that we are recommending today will not only help you, but they will help protect your loved ones, they will help protect your neighbors, and they will help protect people you do not even know. The concept of love thy neighbor is as old as the Scriptures. It is something that we all believe. It is something that will protect your children, your family members, your mom, your dad, your grandparents, your friends, your neighbors, and your fellow Ohioans. By taking personal responsibility, Ohioans are taking the most aggressive action we can against the virus. We have control of this. Our economic recovery and success as a state is dependent upon our respect for one another, and it's dependent upon each of us taking personal responsibility to keep the other ones safe. I truly believe Ohioans have risen to the challenge in the past. We will continue to do so as we move through this period of time.